You're listening to Body by Poly. I'm Dr. Alain Polynice, here to share what I've learned over 25 years in breast and body surgery. Real talk, honest recovery, and the truth behind lasting results. Let's talk about postoperative pain, or pain that shouldn't be there after surgery, or when is pain an emergency after surgery. Now, obviously, after any surgery, there's going to be some pain. There's going to be pain at the incision site. There's going to be tightness, tension, especially if you've had something like a tummy tuck with muscle tightening. There's going to be pain along the abdominal muscles, or if you had a breast augmentation, placing the implants under the muscle, that causes tension under the muscle, so there's pain there. So any surgery has a certain amount of postoperative pain that is normal. But typically, over the course of 2 or 3 days, that pain should really improve and subside. So pain that continues to get worse by day 3 or day 4, that could mean an emergency. So that could indicate a problem with abnormal swelling, fluid collection under the skin causing tension, a problem with healing of the wound. It could be skin necrosis. So it's also important to be evaluated to make sure that all the skin is healing properly, that there's no purple areas or black areas on the skin that could be causing pain. So there are a lot of things that can cause pain. And if it's ongoing by day 3 or 4, then it's definitely something that you want to call your doctor for, or even call 911 to be evaluated, because that could be a pretty significant emergency. There's other types of pain that can happen after surgery, such as calf pain, and that's something you really want to pay attention to, because that could be an indication of a DVT or a blood clot in the calf. So if you have pain if you squeeze your calf, it's excruciating pain, that's definitely something you want to be evaluated for, because that could be a blood clot that could dislodge and cause a pulmonary embolism. So that could be very significant. So right after surgery, you would expect to have some pain. Like I said, normal pain along the incision line, but some pain is not normal. And those are the kinds of pains that you're still having on day 3 or day 4 that continue to get worse over time. So those are the ones where you have to either call your doctor or make a trip to the ER. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.